Welcome back to the channel. Today, we've got an explainer that is literally going to change how you look at your daily habits, your health, and honestly, your future. We're drawing straight from the incredible work of Dr. Non-communicable Joseph. He's a renowned physiotherapist and the founder of the Rehab Haven Physiotherapy and Rehabilitation Center. In his work, The Preventable Body, he uncovers this massive, completely unseen global health crisis. So we're going to use his data and evidence to unpack an epidemic that most of us have no idea we're living right in the middle of.
But first, I want to ask you a question, and I want you to really think about it. What causes 71% of all deaths globally? If your mind goes straight to infectious diseases, or maybe accidents or natural disasters, well, actually, scratch that. You'd be wrong. Okay, let's dive into this and look at the staggering reality of what's actually taking lives around the world today.
Section 1. A global health crisis and the numbers behind the epidemic. To truly wrap our heads around the magnitude of what we're facing, we have to zoom way out to the global scale. Get this, 41 million people die from non-communicable diseases, or NCDs, every single year. Just let that sink in for a second. 41 million people. That is an absolutely staggering loss of life happening annually. But because it doesn't hit us as a sudden loud outbreak, it just kind of flies completely under our radar.
And this brilliantly illustrates how NCDs completely dwarf all other causes of mortality worldwide combined. That remaining 29%, that includes literally everything else. Every infectious disease, every accident, the whole shebang. It means we desperately need a massive shift in how we view what truly threatens human health in the modern era. So, what exactly are we talking about when we say NCDs? Basically, it comes down to the big four. These are chronic conditions, meaning they aren't caused by some infectious bug, and you can't catch them from sitting next to someone on a bus. They include cardiovascular diseases, which, by the way, are the leading global killer, hands down, followed by cancers, chronic respiratory diseases, and diabetes.
To give you an idea of how seriously global authorities are taking this, think about this fact. The United Nations General Assembly has only ever convened high-level health meetings twice in its entire history. The first was back in 2001 for the terrifying HIV/AIDS crisis. The second time, exactly 10 years later in 2011, exclusively to deal with the escalating threat of non-communicable diseases. That's the level of crisis we're dealing with here.
Section 2. Africa's New Battle and the Epidemiological Transition.
When we zoom in on sub-Saharan Africa, the landscape is shifting incredibly fast. Historically, the fear and the healthcare focus in West Africa have been all about those loud infectious diseases, things like malaria and HIV. But there's this epidemiological transition happening as we speak. Projections are showing that this rising, silent epidemic of NCDs is actually going to surpass infectious diseases as the #1 cause of mortality before the year 2030.
So the crucial point is that this monumental shift, it's not about sudden genetic changes or just bad luck. No way. It's a direct biological consequence of 3 major environmental and lifestyle shifts happening right now. Rapidly changing diets that are packed with ultra-processed foods, increasingly sedentary modern lifestyles, and just unrelenting psychosocial stress.
What makes this transition so incredibly dangerous is the timeline. It's like a ticking clock you can't hear. Unlike a virus that gives you a fever in a few days, NCDs have this terrifyingly invisible incubation period. From the moment those lifestyle shifts kick in, a person could go 5 to 10 years silently developing metabolic changes. We're talking endothelial dysfunction, insulin resistance, and they feel totally fine. It takes 10 to 15 years before severe clinical symptoms like a massive heart attack or a stroke suddenly seem to appear out of nowhere.
Section 3. The reality in Ghana. Localizing the data.
Now, what's really interesting about this slide is the dangerous disconnect it reveals right at ground zero in Ghana, where Dr. Joseph does his clinical work. Health professionals call this the knowledge-action gap. Check this out. An estimated 30% of adults in Ghana now have hypertension or high blood pressure, but fewer than 20% of those people have it adequately controlled. It's rampant, but it's rarely managed. It's basically a ticking time bomb for the cardiovascular system. And so much of this is fueled by moving to the city. Urbanization in places like Accra and Kumasi has fundamentally altered how Ghanaians live. Right now, over 50% of urban adults are considered physically inactive, and diets are moving away from traditional whole foods and legumes straight toward deep-fried, ultra-processed street foods. These changes are directly fueling the exact risk factors driving this epidemic.
The result of all these compounded risk factors is deeply sobering.
Ghana's stroke incidence is currently among the highest on the entire African continent. And as Dr. Joseph points out from his practice, these strokes aren't just random bad luck. They are overwhelmingly happening to patients who have had documented, yet completely untreated, hypertension for years.
Section 4. The cost of inaction and the human and economic toll. Let's look at the macroeconomic drain first. NCDs cost low and middle-income countries roughly 2% of their entire GDP every single year. We are talking billions of dollars lost to reduce productivity, premature disability, and staggering healthcare costs. That's money that could absolutely be used to build and grow these nations. But, the data doesn't really tell the full story. The human cost is just so much heavier. Dr. Joseph shares this incredibly poignant story of a patient named Aqua. She's a 58-year-old woman who arrived at his clinic in a wheelchair, completely dependent on her family after a massive second stroke. Looking back at her medical history, he noted, almost every step in Aqua's journey toward that wheelchair had been visible years in advance. Let's move to and see how this builds. Because tracing Aqua's trajectory, we see her condition absolutely didn't happen overnight. She had documented completely untreated hypertension for 12 years, unmanaged diabetes for 8 years. She had a continuous 40-kilogram weight gain while living on highly processed foods with a sedentary, highly stressed lifestyle. It's just a tragic, decade-long path of missed opportunities to intervene long before that life-altering stroke ever hit.
And really, Aqua's tragedy represents a massive systemic failure. This is the very core of the knowledge-action gap. When a healthcare system has traditionally been organized entirely around fighting infectious diseases, the public is left completely unequipped. They just aren't given the tools or the education to understand how their daily habits, what they eat, how they move, how they sleep, are actively driving these chronic, life-threatening conditions.
Section 5. The 80% Prevention Promise. A message of hope.
Okay, while this epidemic is incredibly severe, here is the absolute most empowering statistic of this entire explainer. Up to 80% of cardiovascular disease, stroke, and type 2 diabetes is entirely preventable. I'm going to say that again because it's that important. 80% of these devastating conditions do not have to happen. Our bodies have this remarkable capacity for recovery and adaptation if we just give them the right inputs. And the antidote to this epidemic? It isn't some miraculous, wildly expensive new drug. It's found in highly accessible lifestyle modifications that put the power right back in your hands. We're talking about tweaking our diet to embrace whole, unprocessed foods. It's about consistent, intentional movement. It's treating sleep like actual medicine and managing chronic stress before it breaks our metabolic systems down. So, what does this all mean? It leaves us with one final, provocative question to think about. How do we reclaim our health from a silent epidemic? The epidemic itself might have been undeclared, and it might have crept up on us completely quietly, but the power to stop it is literally right in our hands. The tools to stop this crisis are within our reach, and we are going to show you exactly how to use them. This is just the beginning. Make sure you join us for the rest of this explainer series right here on the Rehab Haven Physiotherapy channel, where we'll be diving deep into the specific, evidence-based steps of prevention, from the exact foods you should eat to the movement protocols that act as real medicine. Until then, take a hard look at your daily habits, stay focused, and keep learning.